everyone, welcome back to Made Easy Way channel. Today's topic is about fracture. Its causes and risk factors, types, signs and symptoms and its management. In this video, I am gonna tell you the easy way or keyword of remembering the types of fracture. If you like this video, hit that like button and do subscribe to my channel to get more videos like this. And yes, press that bell icon also to get notified about my new videos. So without any wasting of time, let's get started. Fracture. Fracture is a disruption or break in the continuity of the structure of bone. It may be due to excessive pressure on bone and bone is unable to absorb this pressure. Next, causes and risk factors. Most fractures are caused by a bad fall, people with underlying illnesses and conditions like osteoporosis. It also found among professional sport-like people. Types. Here is a keyword for fracture types, that is digital scope. D is for displaced fracture. It involves a displaced fracture fragment that is overriding the other bone fragments. Next, I is for impacted fracture. It is a comminuted fracture in which one bone is impacted to another. Next, G is for green stick fracture. It is an incomplete fracture in which one side is broken and another side is bent. Next, I is for intra-articular fracture. It is a fracture extending to the joints. Next, T is for transverse fracture. It is a fracture in which it occurs straight across the bone. Next, A is for avulsion fracture. It is a fracture which results from the strong pulling effect of tendons. Next, L is for longitudinal fracture. It is an incomplete fracture in which fracture line runs along the longitudinal axis of bone. Next, S is for spiral fracture. It is a fracture in which the line of fracture twists around the shaft of bone. Next, C is for comminuted fracture. It is a fracture breaks with several bone fragments. Another C is for compression fracture. It is a fracture which occurs in the spongy bone in the spine. Next, O is for oblique fracture. It is a fracture in which the line of fracture extends towards the oblique direction. Next, P is for pathologic fracture. It is a spontaneous fracture which occurs due to bone diseases. Next is signs and symptoms. Here is another keyword for remembering the signs and symptoms, that is are infected. A is for acute pain. Pain can occur at the site of fracture. Next, H is for hemorrhage, bleeding at the injured site. Next, I is for injured muscle. N is for numbness or tingling sensation. F is for loss of function. Next, E is for ecchymosis. It means discoloration of the skin due to bleeding. Next, crepitus. It is the abnormal popping and cracking sound in the joint. Next, T is for tenderness. Next, E is for shortening of the extremity. Next, D is for deformity or malformation. Next is management. Wound irrigation and debridement should done to make it easier to visualize the wound as well as to help remove debris from the deeper part of the wound. But it should be done by the physician only. Do not draw exposed bone back into the tissue. Stop bleeding by applying moist clean cloth 4 into 4 Dressing over bone. Apply ice to decrease swelling. Cover the wound with sterile dressing. Splint the fracture without disturbing the wound. Encourage the patient not to mobilize the fracture site. It can be reduced by stabilized external fixation. Controlling edema and pain. Check for any damage to blood vessel. Pain medications should provide. Administer intravenous antibiotics or tetanus prophylaxis to prevent infection. Keep the extremity at heart level. Wear loosened cloths. Thank you for watching my video.